Hello, welcome to this website. My name is Ailish Wu. I am a registered nurse, also trained in midwifery and in children's nursing. My husband and I have 5 children, so we have a lot of experience with the challenges of family life. This website is devoted to families who have children and young people with behavioural problems. Today there are many treatment options that are very successful. Disclaimer: this presentation is for educational purpose only. These statements have not been evaluated by the Food and Drug Administration. The following is not intended to diagnose, treat, cure or prevent any disease. Our children are so precious. We want them to eat good food, to enjoy learning together and to have fun and doing activities that keep them fit and healthy. Now we are going to talk about autism spectrum behavioural disorder. Young people can have conditions that are real, painful and costly. The number of young people and their families who are affected by these conditions is significant. It is estimated that as many as 1 in 5 children and adolescents may be affected by autism, aggression, dyslexia and attention deficit hyperactivity disorder in America. Attention deficit, or ADHD, is found in 3 to 10% of children and 2 to 6% of adults, according to the National Institute of Mental Health. Autistic spectrum disorders found 1 in 1,000 children in 1988, 3.4 to 6 in 1,000 children in 2003, 1 in 166 children, according to the Centers for Disease Control Prevention 2007, 1 in 90 to 1 in 100 children, according to the speakers in the Autism Canada Convention 2009, and it is growing by 10 to 17% according to the US Department of Education 2007. So what are spectrum disorders? Well, they are a broad range of psychological conditions and behaviours that have similar features grouped together. Each child is different with symptoms of varying degrees, and it's usually diagnosed by age 3. What do spectrum disorders have in common? Well, they have poor social interaction and they lack communication skills and they have behavioural issues, sometimes quite severe behavioural issues. How would you recognise if your child has autism? Well, look at the developmental milestones. No big smiles by 6 months old, no back and forth sharing of sounds, smiles or other facial expressions by 9 months, no babbling by 12 months, no back and forth gestures such as pointing, reaching or waving by 12 months, and no two-way meaningful phrases without imitating or repeating by 24 months. Any loss of speech or social skills at any age is a red flag. So what symptoms would you expect to see? Well, children very early on show signs of colic and reflux. They have chronic diarrhea and constipation, chronic abdominal pain, high pain tolerance. They can actually cut themselves and not even notice it. They have bad behaviours, tantrums, head banging, self-injury, or they may have a foggy or a stoned appearance as though they were taking drugs. Other symptoms include red cheeks, red ears, dark circles under eyes, which are all signs of food sensitivity. Hyperactivity for no apparent reason, repetitive behaviours and rituals, for example stemming, which is running in circles. They may be screeching. They have sensitivity to light, sound, taste, touch, texture, and they lack ability to communicate, very little eye contact. And sadly for these families, there is a lack of affection. They don't like to be touched or hugged or kissed. Most experts now agree that autism is usually caused by genetic susceptibility. However, it has to be triggered by environmental factors, and this would account for the increase in the numbers over the last number of years. Environmental factors are quite numerous. Some of them include toxic chemicals, metal contamination, for example lead or mercury, autoimmunity and allergies, inability to digest products, for example gluten and casein, and also the overgrowth of yeast or bacteria in the intestine can impede the ability to digest food. The children often have methylation problem. This means that food that is absorbed is not able to be utilized in the body for the energy cycle. Autism is a digestive, immunological and neurological condition. The brain and digestive tract are more closely linked than previously thought. The majority of neurotransmitters are found in the gut. 70% of lymphatic tissue is gut-associated lymphatic tissue. The immune system is intimately linked with the digestive system. So what are the causes of autism? Well, there appears to be a pattern among families supporting a genetic basis. Sometimes you will get a child who has autism in a family has also got a brother or sister with ADD, ADHD. They usually have gastrointestinal disorders. This may be because of a poor development of the GI tract, which therefore leads to decreased absorption of adequate essential nutrients and low levels of vitamins. Vitamins are antioxidants and they fight the free radicals in the body to bring down the toxic level. They are unable to metabolize nutrients, which leads to extremely low levels of glutathione. Glutathione is the most important antioxidant produced by the body. Also, environmental factors can increase the toxicity in the body. So the high toxicity of the body leads to oxidative stress. The body is unable to get rid of the toxins as fast as they are occurring, and this leads to chronic inflammation. So what does the research show? Children at risk have on average low levels of vitamin A, C, D, E and all B vitamins except for choline. 90% are undermethylated. This means they need methionine, vitamin B6, B12 and folic acid. 95% plus are zinc deficient, and they also have low levels of magnesium and selenium and high levels of copper. This information was from Dr. William Walsh speaking at Autism Canada Convention 2009. He has researched autism in more than 6,500 cases. So you have a child who doesn't act like other children the same age. He has no interest in other people but may be fascinated by fans. He chooses to eat very few foods, usually very starchy ones like pasta. Sometimes he sits and rocks in a corner or stares into space. At other times he throws tantrums and runs in circles. So what are you going to do? Well, first of all, you do need to get a diagnosis. But there are other things that you can do on your own. The most important thing is to fix the pain. And this is done by repairing the gastrointestinal tract. The first thing you need to do is put your child on a diet, gluten, casein, and preferably soy-free also. This is not as difficult as it appears. There's a lot of good books that can teach you how to do this. And the difference of putting a child on this diet can be absolutely tremendous. There are products that are very helpful as well to do this. Ultimate Aloe is a wonderful drink which the children usually like to take, and it's wonderfully healing for the intestine. Digestive enzymes help the breakdown of the food so that it can be absorbed properly. The gut also needs to have probiotics to replace put back the good flora into the gut. You need to clear the body of toxins and reduce the inflammation. Omega-3 is a wonderful anti-inflammatory. OPC3 is a powerful antioxidant, and curcumin extreme can be good for older children to clean the liver. To fix the methylation problem, it's a good idea to use specially formulated multivitamins, and we will talk more about them later. Once the medical condition is under control, then you can turn to behavioral intervention, because a lot of these children will have missed some of the growth milestones, and they will need to learn how to go through these again. Now, how do you choose supplements? It is important to choose supplements that are rapidly absorbed, effectively absorbed, nutritionally dense, metabolically active. Vitamins meets all these criteria. Isotonic products can be absorbed into the bloodstream within 5 minutes, unlike tablets that can take up to 4 hours. Vitamin Spectrum provides nutritional support for children, especially those in need of digestive, neurological or metabolic support. It provides children with a strong micronutrient foundation which supports digestion, brain health, sensory development, skeletal growth and detoxification. Ultimate Aloe has been used since ancient times for its healing properties. It contains more than 200 nutrients, including enzymes, vitamins, minerals, and essential amino acids. It provides normal digestion and immune function. Vitamins, isotonic digestive enzymes facilitate and support intestinal function, immune system health, detoxification, and many other things. Enzymes improve the digestion, absorption, and utilization of whatever food you eat or supplements and medications taken. It contains enzymes that break down gluten and casein. Vitamin Spectrum probiotics contain 5 billion colony-forming units from 5 carefully selected bacterial strains. This product was formulated using the patented live-back tableting process to help ensure the viability of the bacteria. It comes in a delicious fruit-flavoured chewable tablets. The adult probiotics are called NutriClean, and they contain 10 billion colony-forming units and 10 carefully selected bacterial strains. Curcumin Extreme is a powerful antioxidant, and it promotes immune function and cleans the liver. Vitamin Spectrum Isotonic Multivitamin. These children are very picky eaters, unable to eat a wide variety of foods, and this provides a strong micronutrient foundation which promotes healthy development and optimal immune function, exceptional absorption and bioavailability. Specially formulated for children with spectrum or for people with spectrum disorders, vitamin B is in P5P form, vitamin B12 in methylated form, folic acid in folonic form, and contains zinc but no copper. Vitamins omega-3 is a powerful anti-inflammatory. It's a fish oil that children like. According to the American Dietetic Association and the Dietitians of Canada, 9 out of 10 children are deficient in the essential fatty acids EPA and DHA. Vitamins Isotonic OPC3 is a strong antioxidant defense, maintaining brain health and supporting the production of neurotransmitters. Due to the excessive quantities of toxins ingested by children, the liver often cannot work fast enough to rid the body of all toxins. As well as pycnogenol and grapeseed extract, this contains extra vitamins and minerals. For information and advice, please contact me directly by email eilisannw@gmail.com. If you wish to purchase products, please go to www.shop.com/4deals. Thank you for watching. For more information, please go to my website childbehaviourdisorders.net. The link is in the description below. Thank you.